So hi, I'm Ruth Elwood Martin. I'm a clinical professor with the Department of Family Practice, and I've been asked to talk about the paradigms of research and relate it to my own story about the different types of research that I've been involved in. And so I'm going to start with this diagram that I based on a paper that I read in 2001 out of Family Medicine, and it's written by Kurt Stange and Ian McQuinney, who is the grandfather really of family medicine in Canada. We'll provide the reference for you in the module if you want to read it. But the paper talked about quadrants of knowledge, and you can see on this diagram the blue quadrants on the left hand side. So I guess on your right, the column on the right, which is blue, is more the objective ways of knowing that are external to us, and the top quadrant, which would be quadrant 3, is the traditional scientific knowledge about disease in the sort of singular, and then the bottom quadrant, quadrant 4, is in a collective sense, that is knowledge of health systems. And we get to know these ways of understanding through traditional science and epidemiology and experimentation, and then if we're looking at health systems, we look at health service research. But there's also another way of knowing in family medicine, and that is the left-hand column, which is more subjective, and the inner ways of knowing. And so as a family physician, a lot of what we do is trying to understand about ourselves and how we respond to our patients. And the way to become aware about this is through reflection, critical self-reflection and journaling. And then if we're looking at the collective ways of knowing, we'd be looking at trying to understand our patient, family, and community. And we do this through understanding personal values and contexts. And our mode of inquiry is in-depth interviews, focus groups, and observations. So as I'm reflecting about my own journey in research, I started off asking questions about the work that I was doing as a family doctor, and it seemed like every single patient I was seeing generated in me a host of questions. And you can go to the literature to try and answer your questions in what is published, but so much of what you're doing as a family physician, it's actually not published. And so I started working as a prison physician in 1994, and a lot of publications are published about the health disparities amongst people in prison. And so leading medical journals talk about the health problems, the disease states, looking at the population and looking at the individuals in terms of their health. And as I got into my career working part-time in the women's prison, I thought, what can I do to help this terrible health disparity that I was seeing? So I started looking at pap smear screening and thinking, how can I understand cervical cancer? I was seeing more cervical cancer and cervical dysplasia in the prison practice than I had ever seen out in the community. And so what I did was I looked at the pap smear screening rates in the prison and compared them, linked them with the BC Cancer Registry, and found that for women aged 25 to 29, the rates of abnormalities were 11 times what the age-matched control rates were in the women in the community. So then I thought, well, can we improve cervical cancer screening amongst incarcerated women? We ended up doing an intervention where we tried to improve the screening rates. We did a survey, first of all, of the women and said, if you were offered a pap smear inside prison, would you be interested in having one? Then we designed the intervention. But 3 years later, only 50% of the women who'd participated in the screening intervention actually had been successful in getting rescreened. And then along comes HPV as being the real cause of cervical cancer, and so I got involved in a more traditional randomized controlled trial looking at comparing HPV testing for cervical cancer, comparing that to traditional pap smear screening. So those were all very traditional kind of research questions and research modes of working. But if you actually look at saying to the women, what's your understanding of pap smear screening, and how can we actually find out from you what are the barriers to pap smear screening. Realize that many women in prison are not getting pap smears because of their traumatic childhood, past history, and sexual abuse. And so I began to chat to the women, well, what about if we could find a way that we could actually encourage you to do pap smears on yourself? So I was brainstorming with my family, and my daughter at the time said, well, Mum, if you used a cat toothbrush on the end of your finger, maybe you could actually teach women to do pap smears on themselves if they could reach their cervical arts. Obviously you can't offer that kind of experimentation to women in prison, so I enrolled my friends and colleagues who were physicians to see if they could actually do this kind of thing on themselves, and gave them kits. And we actually were not successful in being able to do pap smears on ourselves, but we did manage to publish this in the CMAJ to actually describe how we tried to do pap smears on ourselves. But through that was through doing focus groups with the women to find out what their barriers were to screening. Thinking about the other quadrant of knowledge, quadrant 1, which is focus of clinician, I found that my work in the prison was causing me to have a lot of emotion about the women's stories that I was listening to, the hard lives that they'd had. And I found myself starting to journal at about the age of 40. I started to write. I ended up writing some poetry, which I'd never done before. And in fact, we have a book coming out in 2014 that contains some of my journaling, because we decided that a lot of what we were seeing in prison was actually worth publishing. So my physician journaling is actually coming out as some of it anyway is coming out in book form. And then I guess more later in life, I've got more interested in politics and justice and ethics and access, looking at the intersection between the quadrant 3 and quadrant 4, and so have got involved more in advocating for health for prisoners with Ottawa and the federal government. I went to speak to a standing committee on public safety, and also more recently as an expert witness in a Supreme Court case regarding babies of mothers who are incarcerated. So that is it. That brings us back to these paradigms of knowledge. And at the heart of all these paradigms of knowledge is your question. It's the question that drives your interest in whatever aspect you want to be looking at, and that's the thing that will drive your interest in research. So thank you very much for listening.